If you're over 60, what I'm about to share may change how you walk into every medical appointment from now on, because many older adults leave the doctor's office feeling rushed, dismissed, or spoken to like a child, even when they came in prepared, polite, and genuinely trying to do the right thing. Today, we're going to talk about medical age bias, not in a dramatic, everyone is against you way, but in a practical, empowering way. The goal of this video is simple: to help you get better care, clearer answers, and more respectful communication without starting conflict, without being rude, and without leaving the visit confused. I'm going to lay out 5 uncomfortable realities that older patients often face in modern healthcare. 1. The mental shortcuts that can happen the moment your age appears on the chart. 2. The economic pressure that can quietly shape decisions. 3. How symptoms get filtered through stereotypes instead of your real baseline. 4. Prescription patterns that can create problems instead of solving them. 5. The heartbreaking assumptions some people make about your cognitive ability and how to shut that down fast. And most importantly, after each reality, I'll give you specific strategies to flip the dynamic so you're treated like a capable adult with clear goals. Quick note: this video is educational, not personal medical advice. And I'm not saying every clinician behaves this way. Many doctors and nurses care deeply, but systems can create patterns, and understanding those patterns helps you protect yourself. If you've ever felt dismissed or rushed, hit like and subscribe, and comment below. What is your biggest frustration when you seek care? Now let's begin with the first reality. Reality number 1. You may be labeled as expensive and complicated before you even speak. The moment you walk into a clinic, your age can trigger a silent calculation. Not because someone is evil, because healthcare has become intensely time-pressured. Older adults often have more medications, more history, more overlapping symptoms, and more moving parts that require careful thinking. So in some environments, seniors get mentally placed into a category like, this visit will take longer. And when time is tight, that can change the tone of the interaction. Here's what this looks like in real life. You come in with a list of symptoms you've tracked carefully, but you're interrupted early with something like, let's focus on one main concern today. That sounds reasonable until your symptoms are actually connected. For example, someone mentions chest pressure, fatigue, and shortness of breath, and it's treated like 3 separate minor complaints instead of a pattern worth investigating. When complexity is treated as inconvenience, the risk is obvious. Important details get missed. So how do you counter this immediately without sounding combative? Your strategy: start every visit with a measurable goal instead of, I've been tired. Try, over the past 3 months, my energy has dropped noticeably compared to my normal. I'd like to identify why, and I'm open to testing or a step-by-step plan. Or instead of, my legs feel weak. Try. In the last 6 weeks, I've gone from walking 25 minutes comfortably to needing to stop after 10. I'd like to understand what could be driving that change. This does something powerful. It turns you from a complicated older patient into a goal-oriented person with a clear baseline. Next, bring a 1-page summary. Keep it simple. Current meds, allergies, key diagnoses, major surgeries, and your top 2 to 3 priorities for today. If you can hand that paper over in the first 60 seconds, you save time, and time savings reduces friction. And here's a sentence that works extremely well. Doctor, I know time is limited. Could we address priority number 1 today and schedule a follow-up to cover priority number 2? That shows respect for the schedule while protecting your needs. Also, take notes, not aggressively, just calmly. When clinicians see you documenting, the conversation often becomes more careful and more complete. Now let's move to the second reality. Reality, there are two. Polite dismissal can happen when symptoms are blamed on just getting older. This is one of the most common patterns older adults report. You mention a real change, and the response is, well, at your age, or many people slow down. Now, yes, aging changes the body. That's true. But here's the problem. Aging is not a diagnosis. When a symptom is explained away as normal aging, the system may skip the key question. Is this a normal, gradual change or a new shift from this person's baseline? Because what matters is not your age, it's your baseline. If you've always been steady, active, and sharp, and something changes in weeks or months, that deserves attention. So how do you respond without arguing? Your strategy. Ask for evidence and a rule-out plan. When you hear, that's normal for your age, you can calmly ask, can you help me understand how common this is at my age and what we can do to rule out treatable causes first? Or, what would you check if someone younger had the same change? This forces the conversation back into medicine, tests, criteria, and clinical reasoning, rather than assumptions. The next tool is a symptom timeline. Instead of, I've been more tired lately, say, my energy was stable until March 15th. Since then, I've needed afternoon naps for the first time. That's not my normal. That one sentence can change the entire visit because sudden change suggests something actionable. And here's a phrase you can use verbatim. I understand aging affects energy and recovery, but this is a meaningful change from my baseline. I'd feel better if we rule out medical causes before we label it as age-related. That is respectful, clear, and hard to ignore. Now, reality number 3 is even more sensitive because it hits dignity. Reality number 3. Some clinicians assume cognitive decline and simplify care too aggressively. This doesn't mean they call you confused, it's more subtle. They might oversimplify explanations, skip detailed options, avoid discussing newer therapies, assume you won't follow a complex plan, speak to your companion instead of you. Even highly educated, capable older adults experience this. And when a clinician assumes you can't handle complexity, the result is not only insulting, it can reduce the quality of your choices. So what do? Your strategy. Signal competence early. Politely, confidently. In the first 2 minutes, say something like, I like detailed explanations. Please give me the full picture so I can make an informed decision. If you have professional background, you can add, I'm comfortable with technical information. Then ask one high-signal question that shows you're engaged. For example, what are the main options here, and what are the pros and cons of each? Or, what are we trying to confirm or rule out with this approach? Also, bring prepared questions on paper. When clinicians see organized questions, it immediately resets assumptions. And a very practical trick. Use technology calmly in the room. Open your medication list. Show your blood pressure log. Reference your patient portal. It signals, without you saying a word, I'm capable. In the next part, we'll cover 2 realities that can have the biggest impact on outcomes. Prescription patterns that create side effects and confusion, and how economic thinking can quietly shape recommendations, and how to protect your options. Let's continue. We've already covered 3 realities. Being silently labeled as complicated, having symptoms brushed off as just aging, and the quiet assumption that older adults can't handle complex information. Now we move to the last two realities. These are the most practical and the most important because they directly affect safety, clarity, and long-term independence. Four. Medications are sometimes used for convenience, not true healing. This is a difficult topic, so let's approach it carefully. In busy healthcare systems, especially when time is limited, medications are sometimes used to make situations easier to manage rather than to fully address root causes. This does not mean someone wants to harm you, it means the system is under pressure. Here's how it often shows up for older adults. You express frustration, restlessness, poor sleep, or repeated questions. And instead of a deeper discussion, you're offered something to calm things down, to help you sleep, or to take the edge off. The problem is that in older bodies, certain medications can affect balance, slow reaction time, dull alertness, increase fall risk, reduce motivation and confidence. And once that happens, the side effects may look like decline, even though they started with the medication itself. Your strategy: always ask 3 clarifying questions before accepting a new medication. You can say this calmly and respectfully. 1. What specific problem is this medication intended to treat? 2. How will we know if it's working? 3. What is the plan for reviewing or stopping it if it's not helpful? These questions shift the prescription from open-ended to goal-based. Another very effective sentence is, I prefer medications with clear targets and time frames. That alone changes the conversation. Also, keep your own simple baseline notes. How steady you feel walking, how alert you feel during the day, how your sleep normally is. If anything changes after a new medication, you'll notice it early and can speak up. And remember, asking questions does not mean refusing care. It means participating in it. Rauthapatha number 5. Treatment recommendations can be influenced by assumptions about remaining years. This is the most uncomfortable reality, but it's important to understand it without fear. Healthcare systems often rely on population-level thinking. That means decisions are sometimes shaped by averages, projections, and cost models. What can happen is this: 2 people with the same condition receive different recommendations, partly because of age expectations, not individual health. You might hear phrases like, at your age, we usually focus on comfort. Let's keep things simple. More aggressive options may not be necessary. Sometimes that's appropriate. Sometimes it deserves a deeper discussion. The key issue is this: your care should be based on your health, your goals, and your functional level, not just a number. Your strategy. Recenter the conversation on goals, not age. Here's a powerful way to respond. I'd like to understand all reasonable options and then decide based on my health and priorities. Or, what would you recommend for someone with my health profile regardless of age? This reframes the discussion around capacity, not chronology. It's also completely appropriate to ask, what are the benefits and risks of each option for someone like me? If something is not recommended, you deserve to hear the medical reasoning, not a vague age-based explanation. And when decisions feel rushed, it's okay to say, I'd like time to consider this and possibly seek another opinion. That's not confrontation. That's responsible decision-making. You have the bigger picture. None of these realities mean you should fear doctors or avoid care. What they mean is this: you get the best care when you show up informed, calm, and clear about your goals. You don't need to argue. You don't need to dominate the conversation. You just need to anchor it. Anchor it in. Changes from your baseline, measurable goals, clear questions, and your right to understand and choose. When you do that, the entire dynamic shifts. In the final part, we'll bring everything together. How to prepare before appointments, what to say in the first 2 minutes, and how to leave visits with clarity instead of confusion. Now let's bring everything together and focus on what you can do before, during, and after every medical appointment to protect yourself and get higher quality care. This part is about practical control, not arguments, not confrontation, just structure. How to prepare before the appointment. This alone changes everything. Most seniors walk into appointments already at a disadvantage, not because of age, but because the visit starts unstructured. Doctors are trained to respond to clear signals. If you don't provide them, they default to shortcuts. Here's how to prevent that. Step 1. Create a one-page health summary. This is powerful. One page only, not a folder. Include your main concern, 1 to 2 sentences. When it started, what has changed compared to your normal baseline, what you want to achieve. Example: over the last 3 months, my walking endurance has decreased by about 30%. I get leg fatigue after 10 minutes instead of 20. My goal is to identify whether this is vascular, neurological, or muscular, and prevent further decline. This instantly positions you as clear, rational, and engaged. Doctors listen differently when they see this. Step 2. Choose no more than 2 priorities, not 5. Not everything. You can say, I have 2 main things I'd like us to focus on today. This prevents the let's just prioritize shutdown from happening to you. To what to say in the first 2 minutes, this sets the tone. The first 2 minutes determine how the entire appointment unfolds. Start like this. I've noticed a clear change from my normal baseline, and I'd like to understand the medical cause before assuming it's age-related. That single sentence does 3 things. 1. Signals seriousness. 2. Rejects automatic aging dismissal. 3. Invites investigation, not debate. Then immediately follow with, I've summarized this on 1 page to respect your time. Doctors respect efficiency. How to respond when you feel dismissed without conflict. If you hear, that's normal at your age. Let's keep things simple. We don't usually worry about that in seniors. Do not argue. Instead, ask clarifying questions. Examples: what specific findings would make this not normal for my age? Or, what would you check if this change happens suddenly in a younger patient? These questions expose assumptions without accusation. Often the tone shifts immediately. How to handle treatment and medication discussions safely. When a treatment or medication is suggested, anchor the conversation with structure. Use this formula. 1. Purpose. 2. Measurement. 3. Review. You can say, I want to be sure I understand the purpose of this treatment, how we'll measure improvement, and when we'll reassess. This does 2 things. Prevents open-ended or convenience-based treatment. Keeps you in control of follow-up. If the medication affects mood, sleep, or alertness, ask directly, could this increase fall risk or cognitive side effects? That question alone prevents many problems. Bring an advocate when possible. This matters more than you think. Having another person present changes behavior, improves explanations, reduces dismissive language. Your advocate doesn't need medical knowledge. They just need to listen and take notes. Doctors communicate differently when they know someone else is witnessing the exchange. After the appointment, one critical habit write down: what was decided, why, and what happens next. If anything feels unclear, follow up through the patient portal or by phone. Silence after appointments is where confusion grows. Clarity protects you. The mindset shift that changes everything: you are not difficult. You are not complicated. You are not taking too much time. You are a person managing a complex biological system and doing it responsibly. The goal is not to challenge doctors. The goal is to partner with the good ones and protect yourself from system shortcuts. And when you do that consistently, care quality improves dramatically. This is where everything comes together. Not fear, not anger, control. The seniors who receive the best medical care are not louder, younger, or luckier. They behave differently in very specific, repeatable ways. Let's break it down. How can my seniors consistently get better care? Doctors respond to signals, not intentions. Here are the signals that change how you're treated. 1. They speak in observations, not complaints. Instead of, "I don't feel right," they say, "This symptom is new, measurable, and different from my usual baseline." This frames the issue as medical, not emotional. 2. They reference time and change. Doctors take change seriously. Statements like, "This started 6 weeks ago. This progressed over 3 months. This is different from how I've felt for years." These force clinical thinking instead of age-based assumptions. Early red flags that an appointment is going wrong. If you notice these signs early, you can redirect the visit. Red flag 1. The doctor interrupts repeatedly. This often means they've already decided the outcome. Fix it calmly. "I want to be sure I explain the full pattern before we decide." Red flag 2. Symptoms are attributed to age within minutes. Respond with, "I understand aging plays a role. What findings would suggest a medical cause instead?" This shifts the frame. Red flag 3. Vague solutions without investigation. Phrases like, "Just stay active," "Try to rest more." That's common. Ask, "What would you want to rule out before we assume that?" RSL. How to regain control mid-appointment. If the visit starts drifting, pause it. You can say, "Let me summarize what I'm hearing so far and tell me if I'm understanding correctly." Then repeat, "Your concern. What's been ruled out? What hasn't?" This forces alignment. Doctors often course correct at this moment. The most powerful tool: calm persistence. Respectful repetition works. If something is dismissed too quickly, and calmly restate it later. I want to come back to the sudden change I mentioned earlier. You don't need new words. You need consistency. How to end the appointment properly: never leave without clarity. Before standing up, ask, 1. What are we ruling out today? 2. What are the next steps if this doesn't improve? 3. When should I follow up? If there's no follow-up, request one. Unplanned follow-up is how problems get missed. The truth most seniors never hear: the system is rushed, the system is imperfect, but you are not powerless. When you arrive prepared, speak clearly, document changes, and calmly advocate, you become the kind of patient doctors take seriously, not because you demand it, because you signal it. Final perspective. Your age does not reduce your value. Your questions are not an inconvenience. Your life is not less worth investigating. Good care happens when preparation meets calm confidence. And now, you have both.